Neck pain is common. Neck pain can be accompanied by headache. Pain can radiate to shoulder and arm, or decreased ability to move the head. It is called stiff neck. Neck pain often worsened by holding the head in one place for long periods. Good examples which can cause or worsen neck pain are driving the car or working at a computer. The most common causes of neck pain are neck muscle strains, resulted poor posture, working hunching, or working at computer. Neck pain and stiffness can also be caused by sleeping with the neck at an awkward position. Falling or sudden impact that pushes the head to the side, such as sports injuries. Common characteristic of muscle strain is overuse. It can be holding and watching smartphone for hours, or even minor things can trigger it, such as reading in bed. Neck muscle strains will heal itself. Just need time. If pain is significant, over-the-counter pain medications can be used. Sometimes heat or ice therapy can help. Wearing a cervical collar to immobilize a stiff neck is not advised. Rather, an individual with a stiff neck should try to stick to normal activity levels if possible, especially after the first day or two. Another common cause is osteoarthritis. Some people call it degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hands, hips, and knees, but it can also cause degeneration of discs. Cervical part of the vertebral column. Risk factors of osteoarthritis is obesity, age, and female sex. Treatment include physical activity, weight loss, pain relief medications, nonsteroidal anti-inflammatory drugs, and surgery, if other methods failed. Less common causes. Cervical herniated disc. The protective outer portion of a disc in the cervical spine breaks down, and the inner portion leaks out, causing compression and inflammation in nearby tissues. Narrowing of the spinal canal. In rare cases, neck pain can be caused by cancer or meningitis.